Hello, it's Wednesday, November 2nd, 2022. It's Dr. Rhonda Johnson, and I'm talking about RSV, Respiratory Syncytial virus. It's a common virus, usually affects everybody before they turn 2. It's extremely contagious. Most people recover in a week or two, but it can be serious, especially for small babies and even older adults. Now, RSV is the most common cause of bronchiolitis, which is inflammation of the smaller airways in the lung, and pneumonia, which is infection of the lung, in children younger than a year of age in the United States. Now, if you've been following any news, you know that there is a huge increase in RSV. Emergency department visits and hospitalizations across the United States. Now, who is at most risk for RSV? Basically, think children under the year of 1 of age, babies, premature babies born at 35 weeks or less, or infants and children with compromised immune systems, congenital heart disease, and lung disease. Now, what are the symptoms of RSV? Number 1 is runny nose. And children can also show a decrease in appetite, coughing because they're trying to cough up that mucus, sneezing, fever, and wheezing. Now, in very young infants with RSV, you may only see irritability or fussiness in your baby, decrease in activity, decreased feeding, and trouble breathing. So why do some babies have to be hospitalized and children? Because, again, they have trouble breathing and they have trouble eating, which can lead to dehydration. Now, transmission of RSV occurs when someone coughs or sneezes and passes the virus, or if you touch a surface that has virus on it and then touch your face before washing your hands. People with RSV are generally contagious for 3 to 8 days. Prevention involves covering your coughs and sneezes with a tissue. You can wear a mask. You can wash your hands often or use hand sanitizer, and avoid eating behind people, and drinking behind people. Now, for high-risk infants and children, there's a monoclonal antibody called Synagis. It can help prevent severe RSV disease in certain infants and children. Now, you have to go through your doctor for that. Now, treatment is supportive generally. Parents, you got to monitor your child's intake of fluids and your child's breathing. A baby cannot say, "I don't feel good," but they will show it because they won't be as fussy, not as alert, or they may not eat well. Again, they will have trouble breathing if they're experiencing serious RSV infection. So folks, just like COVID, it is time to have a plan. If you have a baby or you have a child, we're entering into the respiratory season. It's time to have a plan. Now, your plan may vary, but here's some basics. Number 1, have a doctor. You always need to consult your child's healthcare professional. Number 2, if you think your infant is at high risk, consult your doctor to see if they're eligible for Synagis. Number 3, have fluids in the house ready just in case. If Pedialyte or other oral electrolyte solutions if you have baby or young children. Some older children may get by with apple juice. Breastfed babies, if they can continue to nurse, let them nurse. You need a thermometer because infants can get a high fever like 103 with bronchiolitis due to RSV. A humidifier may be helpful for some. Having something to do gentle nose suction like an infant bulb suction at home, and have an infant or pediatric Tylenol on at hand. Those are just the basics. You may have other ideas for what you particularly need. But again, we're into RSV season. It has come early than usual. It is hitting hard all across the nation. Be prepared, know what to look for. Some emergency rooms have a 12-hour wait time. So if you're prepared, you may be able to avoid showing up and sitting in a crowded emergency room. That's my message today. As always, this message is not intended to replace the advice from your doctor. Consult your doctor for all of your healthcare needs. Be well, folks, and be informed, and have a plan. Take care.